Hi, I'm Dr. Adatone Musa.
Hi, I'm Dr. Hussein Musa.
I'm a board-certified seizure specialist and neurologist.
I'm board certified in pain medicine, addiction medicine, and anesthesia.
And this is Healing Talks with Kingdom Docs. We're going to continue our conversation on what our purpose is in life and how we incorporate that into our medical practice.
Yes, now I've always wanted to be a doctor. That's been my purpose for as long as I could remember. And since I came to Christ, God has put this desire in my heart to heal patients, to bring faith into my medical practice, and to really provide for the needs of our patients.
Yeah.
And I believe that as physicians, we're positioned to do amazing things. We're trained to see illness, to learn about disease process, the mechanics. But what would the world look like if your doctor was also trained in the spirit and trained in dealing with the spiritual roots of your illness and incorporating that into your treatment plan, and also leading it by praying against illness? And we know that through Christ, we have authority over everything through Christ, that we have authority over sickness, over illness, over disease, that we can do all things through Christ who gives us strength. Now, if we use that authority in our health care, in our ability to interact with patients, I believe that we're going to see better outcomes.
Absolutely. I mean, honestly, I think that the foundation of good doctoring, of good patient care, is love.
Yes.
And if we remember, the two greatest commandments is to love God and to love people. To
Yes.
love your neighbor as you love yourself. And remembering that as I am delivering healthcare is really, really important, and it completely changes the atmosphere. It changes my perspective, and also the patient's outlook and their perspective.
One thing that I know as being a parent, kids know who love them. Kids know who care for them. And that innate ability to know who loves you, that never actually goes away. So regardless of what your doctor is saying or whatever person in authority is saying to you, if they love you and you can feel that love, it lands differently.
It really does. It does land differently. If there's any indication that you're going to someone and you're being vulnerable and they're not reciprocating, they're not loving, they're not caring about you, you become walled off.
Yes.
That trust is broken, and it can also negatively affect your mindset and also physiologically how your body is responding.
Yes, and that's why rebuilding trust with patients, it starts with a physician who loves. And we know that knowing God is love. So having physicians who know God, who know their purpose and wants to bring God's purpose with their purpose in healing, I think you're going to have amazing outcomes. And that's why I'm really excited about our practice, how we have this ability to bring our faith, to bring our love to our patient care, to spend the time with the patient, to help them break down these mental strongholds, to give them God's perspective that He has a plan for us. He has a hope and a future, that God wants good things for us. And by imparting that aspect, that mindset to our patients, I know that we're going to do better, and patients are going to just have a wonderful experience.
It's really important, I think, also to cultivate this culture of love.
Yes.
That's what we're doing in our clinic, in our nonprofit. How revolutionary would it be to have that love culture throughout the entire healthcare system?
To have a healthcare system based on love, that
Yeah.
love gives, love keeps no records of right and wrongs.
Exactly. Yeah.
Love never fails.
It never fails, and the greatest of those is love.
Yes.
So thank you so much for joining us on our last conversation on purpose in the medical field. We're so excited to continue our conversations. Please visit us at kingdomdocs.com.
God bless.
Bye-bye.